Avoid ginger if you are dealing with these 5 health conditions. Known for its spicy and zesty flavor, ginger is a common ingredient in both cooking and natural medicine. People have used ginger for centuries to help with various health problems like nausea, colds, and digestion. Its medicinal qualities are due in large part to gingerol. It is the most important of ginger's many natural oils. While many people may enjoy ginger without any issues, there are certain health conditions where this spice may do more harm than good. It's important to be aware of these situations to avoid making health problems worse. Today's video is all about those 5 common health issues and why people should avoid ginger. And for an exclusive recipe to consume ginger, stay tuned till the end of the video. However, we advise our viewers to consult with their primary care physician or a registered dietitian before making any major dietary changes. Now, let's start. Who should avoid ginger? 1. Gallbladder disease. People with gallbladder disease should be cautious about consuming ginger due to the way this spice interacts with the body's digestive system, particularly the gallbladder. The liver produces bile, a digestive fluid, which the gallbladder is a small organ that stores. Bile helps break down fats in the food we eat, making it easier for the body to absorb nutrients. Ginger may influence the production and release of bile. While this may be beneficial for digestion in healthy individuals, it may cause problems for those with gallbladder disease or gallstones. Gallstones are solid particles that form in the gallbladder and may block the flow of bile, leading to pain and inflammation. If ginger increases bile production, it may exacerbate these issues by causing the gallbladder to contract more forcefully. This may lead to severe pain and discomfort, as the increased pressure within the gallbladder may aggravate the existing blockage. 2. Bleeding disorders. People with bleeding disorders should avoid ginger because of its natural blood-thinning properties, which may exacerbate their condition. Bleeding disorders, such as hemophilia or von Willebrand disease, impair the body's ability to form blood clots. Blood clotting is a crucial process that stops bleeding when injuries occur. When this process is compromised, even minor cuts or bruises may lead to excessive bleeding, posing significant health risks. Ginger contains compounds like salicylates, which are chemically similar to aspirin. These compounds may inhibit the formation of certain molecules that help blood clot, thus thinning the blood. For someone with a bleeding disorder, this effect may be dangerous. Their blood is already less capable of clotting efficiently, and consuming ginger may make it even harder for their body to stop bleeding. 3. Diabetes. People with diabetes should be cautious about consuming ginger because it may affect blood sugar levels. Diabetes is a condition where the body struggles to regulate blood sugar, either due to insufficient insulin production or the body's cells not responding properly to insulin. Managing blood sugar levels is crucial for preventing complications like heart disease, nerve damage, kidney problems, and vision issues. Ginger has the potential to lower blood sugar levels, which may be beneficial in controlled amounts. However, this effect may pose risks for people with diabetes, especially if they are on medication to manage their condition. Medications like insulin or oral hypoglycemics are designed to reduce blood sugar levels. When ginger is added in this regimen, it may amplify the blood sugar lowering effect, potentially causing hypoglycemia. Hypoglycemia occurs when blood sugar levels drop too low. Symptoms of hypoglycemia include dizziness, sweating, confusion, shaking, and, in severe cases, loss of consciousness or seizures. 4. Gastroesophageal reflux disease, or GERD. People with gastroesophageal reflux disease or GERD should avoid ginger because it may exacerbate their symptoms by increasing stomach acid production. GERD is a chronic condition where stomach acid frequently flows back into the esophagus, the tube connecting the mouth and stomach. This acid reflux may cause irritation and inflammation in the esophagus, leading to symptoms like heartburn, chest pain, and difficulty swallowing. Ginger, while known for its soothing properties on the stomach in some contexts, may stimulate acid production. However, for those with GERD, increased stomach acid may worsen the condition. When ginger stimulates the stomach to produce more acid, this excess acid may more easily flow back into the esophagus. The lining of the esophagus is not equipped to handle such acidity, leading to a burning sensation and discomfort. Furthermore, ginger may also relax the lower esophageal sphincter, or LES, the muscle that acts as a valve between the stomach and the esophagus. Normally, the LES opens to allow food into the stomach and then closes to prevent stomach contents from flowing back up. If the LES relaxes too much or too often, as may happen with ginger consumption, it fails to close properly, allowing acid to reflux into the esophagus. This exacerbates GERD symptoms and may lead to more frequent and severe episodes of heartburn. 5. Associated with pregnancy complications. Pregnant women should be cautious about consuming ginger because it may pose risks during pregnancy, particularly in the later stages. While ginger is often used to relieve morning sickness in early pregnancy, excessive consumption or high doses may lead to complications. One of the primary concerns with ginger is its potential to increase the risk of bleeding. Ginger has natural blood thinning properties, which may affect the body's ability to form blood clots. During pregnancy, especially in the third trimester, this may be problematic. As the body prepares for childbirth, an increased risk of bleeding may complicate labor and delivery. Excessive bleeding during childbirth may lead to significant health risks for both the mother and the baby, including hemorrhage. It may be life-threatening if not managed promptly and effectively. Another concern is ginger's ability to stimulate uterine contractions. While mild contractions are normal during pregnancy, excessive or premature contractions may lead to preterm labor. Preterm labor occurs when the body starts to prepare for birth too early, typically before 37 weeks of pregnancy. This may result in a premature birth, which poses several risks to the baby, including respiratory issues, developmental delays, and other long-term health problems. Ginger's stimulating effects on the uterus may increase the likelihood of such premature contractions, posing a risk to both the mother and the developing baby. Now, let's discuss the potential benefits of ginger. 1. Lowers menstrual pain. Ginger is known for its ability to alleviate menstrual pain, or dysmenorrhea, through several distinct mechanisms. Ginger may help reduce muscle spasms, which are a major cause of menstrual pain. The uterus, a muscular organ, contracts during menstruation to expel its lining. These contractions may be painful, especially if they are strong or occur frequently. Ginger has antispasmodic properties that help relax the muscles, including those of the uterus. By calming the uterine muscles, ginger may reduce the severity and frequency of these contractions, leading to less pain. Along with that, ginger may play a role in blocking pain signals in the body. It might affect how the nervous system interprets and processes pain signals. Ginger may modulate the activity of certain receptors in the brain and spinal cord that are involved in the perception of pain. By influencing these receptors, ginger may reduce the intensity of the pain signals that are sent from the uterus to the brain. This mechanism may help lower the overall sensation of pain experienced during menstruation. In a study, 70 participants took 2 ginger capsules daily from 7 days before menstruation until 3 days after, for 3 cycles. Results showed significant reductions in the severity of premenstrual syndrome, including mood, physical, and behavioral issues, compared to the control group. This study suggests that ginger may be a beneficial natural treatment for premenstrual syndrome. 2. Prevents Alzheimer's disease. Ginger may support brain function through several mechanisms, primarily due to its anti-inflammatory properties. Chronic inflammation is a major contributor to various neurodegenerative diseases, such as Alzheimer's and Parkinson's. The active compounds in ginger, including gingerols and shogal, may help reduce inflammation by inhibiting the production of pro-inflammatory cytokines and enzymes. By lowering inflammation, ginger may protect brain cells from damage and reduce the risk of cognitive decline associated with inflammatory conditions. This protective effect may help to maintain overall brain health and function. Moreover, ginger may enhance cognitive function, including memory and attention. This effect is likely due to ginger's ability to increase blood flow to the brain, ensuring that brain cells receive more oxygen and nutrients, which are essential for optimal function. Additionally, ginger may modulate neurotransmitter levels, such as serotonin and dopamine. They play critical roles in mood regulation, memory, and learning. By supporting these neurotransmitter systems, ginger may help enhance cognitive processes and maintain mental sharpness. Plaques composed of amyloid beta are a characteristic feature of Alzheimer's disease. Ginger may be able to help inhibit the formation of these plaques, which could potentially slow down the progression of the disease, according to some studies. 3. Improves cardiovascular health. Ginger may improve blood circulation, which is crucial for maintaining cardiovascular health. Proper blood circulation ensures that oxygen and nutrients are efficiently delivered to the heart and other organs. Ginger has a warming effect on the body, which may help dilate blood vessels and improve blood flow. This vasodilatory effect may reduce the workload on the heart and help lower blood pressure. High blood pressure, or hypertension, is a major risk factor for heart disease and stroke. By improving circulation and helping to maintain healthy blood pressure levels, ginger may support overall cardiovascular function and reduce the risk of heart-related issues. Apart from that, ginger may help lower cholesterol levels, which is vital for heart health. High levels of low-density lipoprotein LDL cholesterol, often referred to as bad cholesterol, may lead to the buildup of plaques in the arteries, increasing the risk of heart disease. Ginger may increase high-density lipoprotein HDL cholesterol, the good cholesterol that helps remove LDL from the bloodstream. The active components in ginger may inhibit the absorption of cholesterol in the intestines and promote its conversion into bile acids, which are then excreted from the body. By balancing cholesterol levels, ginger may help prevent plaque buildup in the arteries and support a healthy cardiovascular system. An analysis of 24 studies involving patients with conditions like obesity, type 2 diabetes, and various cardiometabolic disorders found that ginger generally improved total cholesterol and triglyceride levels and consistently reduced inflammatory markers, thus proving its cardiovascular health benefits. 4. Fights infections. Ginger has strong antimicrobial properties that may help it fight various types of infections caused by bacteria, viruses, and fungi. Compounds like gingerol, shogal, and paradol found in ginger may inhibit the growth of harmful microorganisms. For instance, gingerol has been shown to combat bacteria such as E. coli and Staphylococcus aureus, which are common causes of food poisoning and skin infections. These antimicrobial compounds disrupt the cell membranes of these pathogens, preventing them from multiplying and spreading. This direct action on pathogens makes ginger an effective natural remedy for various infections. Furthermore, excessive or chronic inflammation may damage tissues and impair the body's ability to heal. Ginger's anti-inflammatory compounds, such as gingerol, reduce the production of pro-inflammatory cytokines and enzymes. By moderating the inflammatory response, ginger may help to alleviate symptoms like pain, swelling, and fever associated with infections and may promote faster recovery. According to a study, fresh ginger could successfully prevent the respiratory virus's plaque formation in respiratory tract cell lines. A concentration of 300 micrograms per milliliter of fresh ginger significantly reduced plaque formation. Dried ginger, however, did not show this effect. 5. Boosts immunity. Ginger's antioxidant properties play a crucial role in boosting the immune system. Antioxidants are substances that shield cells from free radical-caused damage. They are unstable molecules that may harm cellular components and weaken the immune response. Ginger contains powerful antioxidants like gingerol, shogal, and zingerone. These antioxidants may help neutralize free radicals, reduce oxidative stress, and protect immune cells from damage. By maintaining the integrity and function of immune cells, ginger ensures that the immune system may respond effectively to pathogens and other threats. Additionally, ginger may enhance the function of white blood cells, which are essential components of the immune system. White blood cells, including lymphocytes and macrophages, may play a critical role in identifying and eliminating pathogens such as bacteria, viruses, and other foreign invaders. Ginger has been shown to stimulate the production and activity of these cells. For instance, ginger may increase the number and activity of lymphocytes, which are responsible for producing antibodies and coordinating the immune response. By enhancing the function of these immune cells, ginger may help the body mount a more effective defense against infections. In a 21-day study involving 68 male healthcare workers, an aqueous ginger extract positively affected the immune system by increasing lymphocyte and RBC counts and higher hemoglobin levels. Smokers and non-smokers experienced an increase in IgM levels, potentially enhancing their immunity against infections, suggesting ginger's immune-boosting properties. Now that you know how amazing ginger's health benefits are when consumed in moderation, you must be thinking hard about adding it to your daily diet. But how should you consume it? Here's an exclusive recipe for classic gingerbread. It is perfect for enjoying during the holiday season or anytime you crave a delicious spiced treat. Classic gingerbread recipe. Here are the ingredients that you may need. 310 grams of all-purpose flour, half teaspoon of baking soda, half teaspoon of baking powder, 1 teaspoon of ground ginger, 1 teaspoon of ground cinnamon, 1/4 teaspoon of ground cloves, 1/4 teaspoon of ground nutmeg, half teaspoon of salt, 115 grams of unsalted butter, softened, 100 grams of granulated sugar, 120 milliliters of molasses, 1 large egg, 120 milliliters of buttermilk. Follow these step-by-step instructions to treat yourself to the classic gingerbread. First, preheat your oven to 350 degrees Fahrenheit or 175 degrees Celsius. Grease and flour a 9 by 9 inch baking pan or line it with parchment paper. Now, in a medium bowl, whisk together the flour, baking soda, baking powder, ground ginger, ground cinnamon, ground cloves, ground nutmeg, and salt. Then, set aside the bowl. Take a large mixing bowl and use an electric mixer to cream the butter and sugar together until they become light and fluffy. It may take about 2 to 3 minutes. Then beat in the molasses until well combined. Add the egg and mix until fully incorporated. After that, gradually add the dry ingredients to the wet mixture, alternating with the buttermilk. Start and end with the dry ingredients, mixing just until everything is combined. Be careful not to overmix. Now, pour the batter into the prepared baking pan, spreading it out evenly with a spatula. Bake in the preheated oven for 35 to 40 minutes, or until a toothpick inserted into the center comes out clean. The top should spring back when lightly touched. Later, allow the gingerbread to cool in the pan on a wire rack. Once cooled, cut into squares and serve. Optionally, dust with powdered sugar or serve with whipped cream for an extra touch. Enjoy this warm, spicy, and fragrant gingerbread with a cup of tea or coffee for a perfect treat. Here are some tips to make this recipe even better. For a richer flavor, you may use dark molasses, but avoid blackstrap molasses as they may be too bitter. If you don't have buttermilk, you may make a substitute by adding 1 tablespoon of vinegar or lemon juice to half a cup of milk and letting it sit for a few minutes. Ginger, despite its numerous health benefits, is not suitable for everyone. Individuals with gallbladder disease, bleeding disorders, diabetes, GERD, or those who are pregnant should exercise caution and consult with healthcare professionals before incorporating ginger into their diets. Understanding the potential risks and interactions is crucial to ensuring that ginger consumption does not adversely affect your health. Now that we have discussed the many health conditions that may require you to avoid ginger, let's talk about some other topics of interest. Interested in knowing more about health secrets? Watch 12 bad daily habits that are destroying your kidneys. You may also try our video on what happens to your body when you have fatty liver disease. Go ahead, click one, or better yet, watch both and learn more about your body. How do you consume ginger? Let us know in the comments below.